Next up in 25C, we're going to talk about parenteral administration. So these are routes of administrations for drugs, medications that generally use a needle or IV. So we are giving this medicine into your body, right? We're not taking any chances that you might spit it out or poop it out or what have you. There are some significant benefits with parenteral administration. One is you can get very rapid drug delivery into the circulatory system because with some of these methods, you're going directly into the bloodstream. They also don't require the use of the GI tract. So if somebody is unconscious or critically ill and can't swallow, or if it's a drug that can't be absorbed or that would be destroyed by first pass metabolism or would be too irritating to put sublingually or what have you, this is an excellent way to get the drug or medication into the body. But of course, it's uncomfortable. These are more invasive, so there's risks of infection, and it requires special equipment. And we in the Western world might not think that having availability of a clean needle and a syringe is that big of a deal, but there are many parts of the world where it is a very big deal indeed. So when we think about medicine globally and healthcare globally, this is often a big sticking point for this. There was recently actually a huge HIV epidemic in a hospital in a developing nation. I can't remember exactly which country it was because they were reusing needles and IVs. So they would put it in somebody who had HIV and then they'd put it in somebody else. And so there was a huge outbreak because they were reusing needles that were not intended to be, right, and not sterilizing them in between. So method number one is intramuscular or IM. So we're injecting the drug, the medication, right into a muscle. This allows us to deliver a pretty large volume of drug or substance, because we also use this for vaccines, that will then diffuse into the bloodstream. And now muscles, because when they're active, they use so much oxygen and glucose, muscles have a very rich blood supply. So if we think about like that nasal membrane and all those blood vessels, muscles have a lot of blood vessels in them too. So you get pretty rapid delivery into the bloodstream if you inject into a muscle. And if you do it properly, it's very safe for the most part. So we use this for most vaccines. We also use it for some antibiotics if we need to get it into you pretty quickly and with a large dose that would be too difficult to do orally for one reason or another. And we also have the ability to have some specially formulated medications that are like slow release form that we can give intramuscularly. So one example would be Depo-Provera, which is the birth control shot. It's depomedroxyprogesterone is the medication, and that first word, that depo, means it's like it's a depot. We put a whole bunch of it there and then it gradually kind of distributes. So that's pretty cool. There's actually also a slow release medication that's used to treat schizophrenia, which is a condition where a lot of times people don't realize that they're mentally ill, and so they will often not take their medicine if it's a pill form because they think they are fine. So there is a medication that's a once a month shot where then it's slowly released and then you know they actually have the medicine in their system. So it has a lot of benefits as an administration route. Similar but different is subcutaneous administration. So in subcutaneous or sub-Q, as it's often called, sometimes abbreviated SQ, you're not injecting as deeply. You're not going all the way down into the muscle. You're just going underneath the surface of the skin. So cutaneous means of the skin. Remember our cutaneous mechanoreceptors. Yes. So sub means underneath, like a submarine ship, right, that's underwater. So subcutaneous means underneath the skin. So underneath their skin, there's this kind of fatty layer that we all have. Even if you're really skinny, you have one. It just might not be very thick. And so we can use injections, sometimes are given this way, or sometimes we can do continual release this way, which is interesting. So if you know somebody who has an insulin pump for diabetes, the way this works is that little patch that's on this person's belly here so this tube, which is delivering insulin from the pump, goes into, there's a little teeny needle that is on the other side of that patch that is going right into their subcutaneous layer, and so you can continuously deliver a medication this way. So that's pretty cool. Absorption from the subcutaneous route is a bit slower than intramuscular because there are not as many blood vessels here. It's just not rich with blood vessels like the muscles are. But so you get kind of like a slower onset, more sustained release. It's also used, interestingly, for the slow-release birth control implant, which you might know as Implanon or Nexplanon, which is this little plastic rod that is impregnated with etonorgestrel, which is a progestin, that you slip underneath the skin in the subcutaneous layer of the upper arm, and it just stays in place. And then it gradually releases into this layer, and then it gradually gets into the bloodstream. So it's a pretty neat way to administer drugs, either for a one-off with an injection or a continuous infusion by a pump or a release from an implant. So many other types of implants work this way as well. The only disadvantage is that it's slow, which maybe is a good thing, slow and gradual, and you can't do very large volumes, right? You can do a larger volume into a muscle than you can into the subcutaneous area. Next, we're going to talk about intravenous or IV. So we're going right into the bloodstream here. We usually access a vein because veins are easier to access. They are less risky. There's a decreased likelihood of things going terribly wrong if you poke a hole in a vein compared to if you poke a hole in an artery. And again, as I mentioned, they're easier to access. So you're going to get the drug directly into the bloodstream. So you're going to have near immediate effects, which is pretty awesome. So it's rapid. You can give large doses. You can obviously avoid first pass metabolism. And you can continuously give drug through an IV, right? So if you want to give a slow, sustained drip, 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 you can do that. You can give IV fluids this way, right? So it's pretty darn cool. Now, I want to be clear, if you get an IV placed, they have to use a needle to put it in place, right, in order to poke through the skin and get into the vein. But then once they get into the vein, they slide this little tube, and I don't know, I was kind of disappointed at the photos available. This is a little thin plastic tube. That is all that is left behind. So they use the needle to place it, and that's over top of the needle. So they go in together, and then they pull the needle out, and the tube stays in place. And so if you have an IV, it's just this little flexible, tiny little plastic tube that's sitting inside your vein. The needle gets removed. So just so you're aware, sometimes people are like, I don't want to have a needle in me. You don't, except for when they just immediately position it. All right, and then they're going to tape it and make sure it doesn't fall out. So that's IV. We use that a lot, obviously. Lastly, I'm going to share with you intrathecal, which the book left out, which just gobsmacks me, because this is where you are delivering drug directly into the cerebrospinal fluid. One of the ways you can do it is down at the spinal cord. So you can see this needle here, and they've gone through, this right here is the dura mater. Yes, so and then they're into the subarachnoid space where that CSF is circulating, right? So you can actually deliver drug directly into the CSF, which is amazing because it allows you to bypass that blood-brain barrier. So remember, we had those tight endothelial cell junctions, so our capillaries are not leaky in the CNS, and then we have the end feet of those astrocytes as well, providing an extra barrier. So it can be quite difficult to get drugs into the central nervous system. It can be difficult to get drugs into the brain and spinal cord. So this can be very useful sometimes if you have a drug that doesn't get through the blood-brain barrier very easily and somebody has a problem in their brain or their spinal cord. This can be a great way to get the drug where you need it. So if somebody has a bad infection like a meningitis or a brain abscess or something like that, or more often we see if somebody has certain types of brain cancer and you need to deliver chemotherapy drugs to the tumor, this is going to be one of the most common ways we'll use an intrathecal administration. And sometimes they'll just put something in place, basically like an IV, a little tube like that to deliver over a period of time. Or sometimes, especially for certain neurologic conditions, they might even install an intrathecal pump. So this is amazing. So if we we remember when we talked about diseases that impact the motor system, and we talked about the difference between upper motor neuron problems and lower motor neuron problems. And normally the upper motor neuron is inhibitory, so if you lose or damage the upper motor neurons, you tend to get that spastic paralysis, right, where you're very rigid and stiff, and that can cause a lot of problems. So a medication that can be used to help with that, with spasms and things, is a medicine called baclofen. It can have a lot of side effects if you use it through your general circulatory system, so they can actually install a pump and just deliver it to the part of the body where you need it. So that's pretty cool. So that's intrathecal administration. So overall, in summary, parenteral routes allow for rapid and definitive and even continuous drug delivery, like through pumps or IVs, all those types of things. They require special equipment and they're more invasive, so they have a risk of infection. They also have a higher risk of some type of allergic or immune response, so we always want to keep an eye on folks when we're administering drugs or medications in this way. So IM, that's a shot into your muscle, really good for larger doses, get quite rapid absorption into the bloodstream. Subcutaneous is more comfortable, a little easier to do, and you get a slower absorption into the bloodstream. IV, rapid and definitive. We're going right into the bloodstream immediately. And then intrathecal can be really useful when we want to bypass the blood-brain barrier or deliver an agent directly to the central nervous system. So that's it for parenteral routes. Up next, respiratory and dermal.